Here we are. Okay. So, good morning, everyone, for another wonderful webinar led by Defne Özkan. This morning we will talk about, well, the title of our webinar will be What is Given and to Whom? Defne is a bachelor student at the Catholic University in Leuven. Her main interests are in phenomenology, metaphysics, and the ethics of care. And she also took a particular interest in reproductive health and how the body is cared for in a medical context. We are NoBumpNoCare, a platform for reproductive rights that collects together professionals in different fields for the wealth of people on their journey for taking care of other children or babies and reproduction rights in general. So it's my great pleasure to have you here, Defne. The floor is all yours, and I'm eager to listen.
Okay, thank you. Hello, everyone. I'm Defne. And today I will talk a bit about the lack of nuance and complexity I have observed and experienced myself when it comes to providing care for pregnant women, particularly in the earlier stages, I think. I mean, no bump, no care. I think the when we don't really see a bump, or when it's not really a concrete being we call a baby, I think, in someone else's body, we don't really put a lot of thought and care into this, I think. And I found that the categories in which we think this time of pregnancy is also quite reductive, and there are a lot of meta-narratives we fall under when we hear a story from someone about their pregnancy and their early stages of pregnancy, whatever the characterization of the pregnancy might be. I mean, it can be a wanted pregnancy, unwanted pregnancy for many reasons. It can be wanted and unwanted at the same time, because obviously it's a very complex issue in most cases. And I think that it usually falls under a sort of profiling of the pregnant woman. So if the woman is married, and if it was a planned child, and they have the means of caring for this child financially and mentally, I think we give a certain response. If it's not this case, we give another response. If it comes with health problems, we give another response. But I think usually this part of pregnancy can also be quite alienating for the pregnant person, because in this case, it's not really the person we're viewing, but the pregnant profile we're viewing, I think. And this lack of nuance we put into this specific period of pregnancy is what I want to talk about today. And the reason why I find the early stages, the first trimester, as we call it, very crucial is one, that it, first of all, challenges the conventional ways of knowing and representing the body. Because of course it still looks and functions almost the same with a few tweaks. But there is a big new change that is unseen to all people, including the pregnant person at this stage, because the pregnant person, I think, even after the confirmation of pregnancy, there is still a very complicated and long time until this pregnancy is made sense of, and it can take like a plethora of different senses. And I think the only way we can create the space to make all of these very fruitful senses, that is through understanding the pregnant person better in their lived particular experience, I think. I think this is a very common theme to all of the webinars also, which is why I wanted to talk about it as well. And more crucially, I think the first trimester is a very vulnerable time for the pregnant person, because she now comes to term with this new state that is just presented to her very abruptly. Because even in the cases of wanted pregnancies, we don't really know when this will occur, how this will occur, and under what exact conditions the pregnancy will be positive. We never really know these things. So it can also be very difficult, even for a family who wants new kids. So it is a very vulnerable time for the individual person or the family or the community to make space for a new child, or to think about what sort of spaces can even be opened up for a new child or not. And I think this re-schematization of life can be quite a vulnerable stage. And usually I find that the early stages are very crucial to talk about, because of the second reason, because it can be very, very vulnerable. Wait, what did I write here? Yes. So usually I find it's the second case, which is it's vulnerable because we need like a radical schematization that we don't really know where it will end up, because it is a very privileged position, financially, mentally, and also socially, economically, to not be confused at this time. I think to happily say, yes, I'm pregnant and this is happening in 9 months. Yes, okay, let's go. This is a very rare case. It usually never happens, I think. So it is a very challenging situation. I think every case of pregnancy also challenges the people who come to know about this pregnancy, because they can be in a state where they don't know what to respond with. It can be a very hard situation to deal with. It can be a very complex and also morally very difficult situation to judge, I think. And all of these difficulties, I think, really close up the space socially and also medically, for women to get the appropriate care in the earlier stages. And so here I want to talk about my starting point a bit for my interest in this topic in general, because I think this will contextualize it a bit more. So I thought a lot on if I should talk about this or not talk about this, and most of my friends were like, oh, don't say this on YouTube, everyone will know. But I thought it was relevant because for contextualization and also for opening up new discourses, I think. But 2 years ago, or a year and a half ago, I think, I also terminated a pregnancy. And what my intention of bringing this up is not talking about abortion, because this is not my aim here, or it's not also like turning this presentation into a personal confessional about what I went through. But when I was going through this, I really experienced a lot of loneliness and a lot of lack of nuance, like I said, with the responses I got from my friends, from my family, or from healthcare professionals as well. And it's obviously a very complex and challenging issue. And I cannot really say I have the same thoughts I have about abortion 2 years ago, or like my reflection process has been very stable. I really cannot say these things. So it's safe to say I had a lot of mixed feelings about this. And it took a lot of also like theoretical turns in my philosophical journey as well, thinking about this, which was really interesting. But I think the issue I faced was never really about regret or shame or a moral judgment regarding making a wrong choice, but it was rather a very big confusion and loneliness that I felt that made me very incapable of forming thought in the first place. And I as a philosopher, this was really difficult for me, because I was like, okay, how can I not have the proper framework to explain my experience? I always am able to do this, but right now I don't have the sufficient categories, the sufficient arguments to assess the situation I'm in. Because I would ask myself, okay, what do I really feel about this? And my only answers would be, oh, okay, this is an impossible situation, or like I have to do a certain thing. But none of these are really answers, I think, to how one feels or what one is going through. And all of these shoulds or woulds or impossibilities and possibilities and profilings, I would say, because I think when we do see a pregnant person, or when we hear about someone being pregnant, the first thing we do is we really profile this person to judge if the pregnancy is appropriate or not to this person's situation in life, which I think can put people in quite vulnerable situations because we really rid them of their humanness at this point, and they're just a pregnant person who's supposed to make a decision appropriate for their profile, basically, socioeconomic profile mostly, and where they are in their state of life. But this can really create, I think, a barren emotional and intellectual framework for a lot of pregnant women. So this was more or less my starting point for my interest in reproductive care and also pregnancy care. So from this starting point, I will talk today first about why I found the modern medical representations very brute, first of all, because medical representations of pregnancy can be, I think, particularly reifying and alienating for the pregnant person, to understand her body, to understand what her body will turn into, what possibilities she has. And then I will explore morning sickness as not from a medical point of view, but from a very phenomenological and existential point of view. And hopefully I want to see how we can move away from very affirmative or not negative positive pregnancy confirmations and representations to a more, I would say, indeterminate but experience-based understanding and knowing pregnancy in the first place. So regarding modern medicine, this is a big topic on its own, of course, and what I will say about pregnancy can be well extended into other types of lived experience under modern medicine, I think. So here a very simple distinction we use in phenomenology is Leib and Körper, body as object Leib and body as subject Körper. And I'm afraid really modern medicine has reduced almost all bodily lived experience to the body as object category. Civilization and discontent. Here I say I'm really like not happy with most modern epistemologies we have. But truly, if we ask ourselves what answer do we get to the question of how is pregnancy perceived and known in the first place, we don't have a lot of answers other than a pregnancy stick that is taken at home, a blood test, an ultrasound, maybe a missed period. It's also a big pregnancy sign, but it's not really a telltale sign either. So all of our telltale signs are very representative, and they're very reified representations, and they're very positive, not in the sense of good or bad, but positive in the sense of clear, distinct, and decisive and concise, I think, representations that do not take the whole of the body into account. So without the missed period, I think the first answer we would give to my question would be an at-home urine test. And this is a very infamous image, I think, also in the Western social imaginary. We see it all the time in movies. It's a big scandalous moment where like one takes the stick and says, oh, your whole life changes in this one moment where you see one line or two lines. It's quite caricaturized, I think, as an image when I think about it. And finding out about one's pregnancy, I think in the modern Western context always includes the two lines on the stick on the scenario. And I find this quite, first of all, weird, which is not really a formal way of saying this, but I find it really weird and also daunting. Because I myself also, when I first saw the stick, it wasn't really like, okay, now I know something new. It doesn't really give you new knowledge, I would say, or it's not really a proper confirmation in a sense either, because it doesn't really reveals one body to oneself, but it just says something. It just signifies something, because the body is still normal as it was 10 seconds ago before seeing the stick, I think. There is no bump, there is no nothing, there is nothing that happens immediately. It still is the same continuous timeline, but with a big disruption that now makes us think we have to move on this new information we have, which is very alienating, I think, especially if it was an unexpected pregnancy, or I'm saying unexpected here in a very broad sense, because like I mentioned in the beginning, most pregnancies are very unexpected, and they rarely happen under ideal conditions. So if it was unexpected, if it was something also, if you haven't put much thought into, if it was something you didn't really consider a lot, then the confirmation of pregnancy, knowing that one is pregnant, can be a very indeterminate moment, I think. So I kept asking myself, also after throughout these years, so how are we to really know pregnancy? How is it that we come to say, okay, I am pregnant, if we take out all of these very brute representations? And then there is the category of also women who were pregnant and their testimonies were like, oh, I've always known, I've just felt it. The day I conceived my child, I felt it, and I felt the gender, I felt everything. Which to me is also quite caricaturized, because a lot of people do not fall under this category. And I find, I heard quite a lot of women also say, okay, I didn't feel this maternal sentience, I didn't feel this immediate warmth at finding out about my pregnancy, I didn't feel this immediate excitement. I didn't really feel like it was real at first. I mean, I knew this was the case, but I didn't really feel like I was supposed to take the lifestyle steps I should take to further the pregnancy. I heard all of these very confusing statements, and a lot of them were just confused and unclear, and a lot of them I felt were longing were someone to just ask them, okay, but how are you really? Or like some space where they just be asked, okay, but how are you really feeling and what is going on? So here I want to refer to Merleau-Ponty's phenomenology of perception, when he was talking about the phantom limb syndrome. And I will read what he said. Just let me find it in my notes. Okay, so he says, he talks about phantom limb syndrome, or anosognosia, how is it pronounced? Where anosognosia, it's where someone has, yes, someone is not aware of the reality of their syndrome. So he says regarding these two pathologies, if these phenomena are now given a psychological explanation, the phantom limb becomes a memory, a positive judgment, or a perception, and anosognosia becomes a forgetting, a negative judgment, or a non-perception. In the first case, the phantom limb is the actual presence of a representation, and the other case is the actual absence of a representation. In the second case, the phantom limb is the representation of an actual presence, and anosognosia is the representation of an actual absence. In neither case do we escape from the categories of the objective world, where there is no middle ground between presence and absence. And I think this obviously differs from pregnancy, because pregnancy, we do not really pathologize it in this case, or we do not really call it a disorder. But I think the part where he says categories of the objective world where there is no middle ground between presence and absence, this is where it's important for us. Because pregnancy similarly is not just something we can represent, I think, with an actual representation or the lack of a representation. It's here, like Ponty, I would also call into like criticism the classical psychological, physiological, and mechanistic explanations of bodily phenomena, where traditional accounts reduce these either to presence or absence of mental representations. But such explanations remain trapped in the binary categories or affirmation and negation, whereas the lived experience of these phenomena discloses an ambiguous mode of being, which is something in between. And I think in this something in between ambiguity, there is a lot of epistemic richness. And just because we cannot really place it in one category or another, it doesn't mean we do not know anything, or it doesn't mean the pregnant person cannot know anything without an external representation or an externally given object that her body must conform to. Likewise, so early stage pregnancy and the embryo are often represented in medical and dominant modern narratives as objects to be measured, known, tested, configured, using very rigorous epistemic means. And there is a lot of invasion on the body, of course, in general in modern medicine, and also in reproduction in general. From the first time a girl menstruates to menopause, there is so much invasion, so much reconfiguration testing, so many treatments one is offered, so many unknown like external things one is given, like pills. We still don't know how the pills work. Also in regards to birth control, this is also the case. We still don't know really how these mechanisms work in their complexity in the background, I think. And yet these things are still really invaded, really worked on. The body is really surgically manipulated, opened up, closed, as if it's a non-living object, I think. And this to me is really daunting, I would say. And so without all of these diagnostic tools, when we're faced with the question of how pregnancy is first known, it becomes a very interesting question, because which perceptive modes do we use, for example, to understand this? I think other than touching, there is not a lot to be perceived. We cannot really see the inside of the womb. We cannot really hear what's going on, except for an ultrasound, but I'm bracketing out all of the external representations here. So a very soft epoche method, I would say, not it cannot really be heard or smelled or seen, tasted. We cannot really do any of these things to the inside of our bodies, and we can't really touch the inside of our bodies either. We can only touch the outside. So how is it perceived unknown? And I think it's perceived unknown in a way that is very interoceptive, in a way that is very unclear also to the subject themselves, and in a way that that provides us the most rich knowledge substance through a lack of knowledge, I would say. And this is also something I see that we lack in modernity when it comes to epistemology. We always look for propositions. We always look for positive propositions to know more, to say this is that, and this is that, and this is how we draw an embryo, and this is how your belly looks at 7 weeks, 8 weeks, 10 weeks, 30 weeks. But hardly any of this knowledge, I would say, is really helpful to pregnant individuals to know about their bodies better. Of course, there is a part of me that also thinks, yes, okay, like these are good additions to our lives because we get to know and plan a bit better. But also, like I said, I think there is a part of it that is very invasive and alienating for the body, of course. So in this sense, pregnancy not only resists a categorical clarity, I think, it also reveals a mode of existence in which ambiguity is constitutive rather than just being an incidental property of pregnancy. It's really, I think, the first trimester is constituted by this ambiguity, constituted by these questions, by these potentialities. It's not, I think, a mere contingency of lived experience. It's not just something that happens to the body and, okay, it's fine if we don't really understand it, but it happens and we figure it out. But it really is something that is the condition for the continuation of human life, because all human life continues through pregnancy. And I think all pregnancy gets its initial burst from this ambiguity. And each and every one of us owes our existence to this like weird, ungraspable thing, I think. When I think of pregnancy, I really feel so mesmerized each time, because it doesn't matter how much I know about what goes on. It's also very interesting to know medically, like with the details, what goes on. But also when I think of it, it just mesmerizes me every time, because how is it that something we can explain so in detail physically, we still cannot really understand how these cells turn into conscious life, how these cells then grow to be capable of speech, be capable of love and emotions, and growing up as an adult human. This I think is a very mysterious process that takes place here. And my disturbance with all of these invasive, reifying methods and procedures is that I think it really takes away from also this mystery of it. I would say we are really in this demystified mental state when it comes to anything happening in the body, but especially pregnancy, I think, and it's really desensitized also. I really find the modern person is very desensitized to pregnancy, the occurrence of conceiving an embryo, because everyone to me said, for example, oh, it's not a baby, it's just a fetus, it's an embryo, it's a blob of cells, it's this, it's that, okay, don't feel bad. And I was like, okay, it's not gonna like make me feel bad or not bad if I know what it is. It doesn't really matter what you call this thing, it's just strange anyways, and it's just hard to grapple with in either case. And this is something I really find lacking also in medical professionals, because they are dealing with pregnant people every day who want to carry it to term, who want to terminate it, who have questions, who might have doubts, who might go to them for actually finding some safety in their doubts. But I'm sure everyone is faced with all of these walls that just tell them, okay, this is your body, this is the state your body is in, and this is what we can do with your body or not do with your body. And this I think really is not the way to provide care, to say it simply. So what does this really mean then for the pregnant subject? It would be a bit funny if I could answer this after saying everything about the indeterminacy and the lack of clarity, but I think there's a very strange way of comprehension and reflection here that is dependent on the relationship of you producing life in you, and this thing you're producing in turn reproduces you. Because we don't really know who this baby is, what this baby is when we're pregnant until the baby comes out. We have never seen this baby, but it forms the pregnant person very, very drastically through this pregnancy procedure, of course, even more so if it's carried to term. I think no list of bodily changes or detailed analysis can capture the profound mystery of carrying and growing another human being from one's own flesh also. And reproduction in this way sustains life through disrupting a sort of individual continuity, because something is happening through one's flesh, something is multiplying and growing through one's flesh, and this something will individuate from one individual. And this is a rupture, I think, in individual continuity. And this rupture in the individual continuity, a sense of self is definitely ruptured. This is what I mean by individual continuity. And I think it's also a temporal disruption of continuity, because then this whole pregnancy is projected into the future, and the pregnant person sees herself in light of this new temporal possibility, and everything is temporally also shifted. And in terms of the self, it's very shifting at this point. So it's very discontinuous. It's very day-to-day different. It's very not simple at all. And through the continuation of life, there is the discontinuation of the self. And this tension at its core, I think, is the reason why we should really be open to understanding how this strange thing affects someone, and how this strange thing doesn't just affect hormones or the body or anything we can physically explain a causal chain, but it affects someone spiritually also. I don't just mean new age spirituality or religious spirituality, but really it's a deep, intimate relationship one faces with one's own soul, I think, at this point, to really look at oneself and say, okay, what am I doing with the situation? It's a deeply confrontational and spiritual moment for someone, I think. And because of this, I found that a lot of my experience was very alienating, because I felt, okay, I'm what am I confronting? What am I feeling? What is changing? What is not changing? It's just very scary and strange. So here I will then talk about morning sickness and nausea, because I think it is really one of the richest sources of knowledge for the pregnant person, I think, because it's a really like a weird thing to be nauseous all the time. I think it's very disruptive. It's also very apparent. It's very in one's face. It's not just breast tenderness or disruption in sleep or fatigue. It's really something you are faced with all the time. And if I'm talking about nausea, I will and since I'm talking about it phenomenologically / existentially, I will bring in Sartre, of course, from Being and Nothingness, because this was my inspiration. I thought I was reading this passage and I thought, oh, okay, nausea, good, but what is one classic example of really specific nausea? It's morning sickness. And morning sickness, I think, can really be put into this framework of existential nausea. So Sartre says regarding nausea, let me just find this quote. Sorry, I have so many tabs open. So he says he characterizes it as a dull and inescapable nausea perpetually reveals my body to my consciousness. Here, I think it being dull, inescapable, perpetual, and revealing are very important. They are how I would also characterize morning sickness. Because the strange thing about nausea is, yes, it happens in the stomach, and we feel it in the stomach, but it's also the whole body is taken away by the disturbance nausea brings. You don't really know where it's coming from. Is it coming from your head? Is it coming from your stomach? Why are you really nauseous? And then your body really demands that you just purge something. You turn your insides out. You are constantly like disturbed by something that is within you. And this is also quite confusing, I think. And this perfectly exemplifies how early stage pregnancy is known in a better sense. It's not really known when we see an ultrasound image or we see a pregnancy stick, but it's really known when we are disturbed by what's going on in our own bodies, I think. And with nausea, a very particular thing is that I think it's very constant, and there is no part in the body in which we can refer to as the object of our nausea. There is nothing in the body that we can point a finger to. There is nothing that is an object that we perceive as a subject. I think when we're nauseous in general, we never say, okay, I am right now feeling this and this is that. It's just this very confused thing. And then you're like, okay, who am I? What's going on? And then you're just vomiting, or you don't want to eat, and every bodily procedure is disrupted. I also really don't like food poisoning for this reason. But yes, so what was I saying? So in nausea, I think there is not really an intentionally given object. And this is why I called my presentation What is Given and to Whom? Because first, when I was thinking about all of these, and I was writing on the phenomenology of pregnancy for a class as well, when I first started brainstorming, I thought of first writing about intersubjectivity, or what sort of interesting intersubjective dimension we can explore with the pregnant person and the fetus, or the baby. But then I was like, okay, this is a weird thing to classify as intersubjectivity, because it's not really a subject, or the child is not a being in the world yet, but it is still a very present object. It's still a very present thing, but it's not this discrete object, I would say. And there I found the conventional structures also in phenomenology we learned about. So when we perceive something, there is an object, and we are intentional subjects, and we intend this object, and this object in turn is constituted in our subjectivity. It's quite easily a binary process, I would say, between the subject and the object. and an object in phenomenology we say is given to the subject, and the subject can then see or hear or perceive this given, revealed, manifested object. But in pregnancy, I think there is no real subject-object distinction, especially in the first stages when one is coming to terms with this. First of all, there is no actual other subject yet. There is no, the pregnant person is not a subject in the sense of the subjectivity has not been molded, I would say, to being pregnant yet. The subjectivity doesn't really have the idea of being pregnant or being a potential mother yet. It's still quite confusing, and there is still a lot of reconstitution of the subjectivity and the subjective experience. And also there is no actual given object. And I feel the whole body at once is given to the person in the experience of nausea, because your whole body is given to you, your whole body is being purged out of you. And all of these modes can really create a moment where the person can say, okay, my body is actually changing and I have to understand this change and come to terms with this change, with these changes. So this is a time where all of these are happening. And I think my thesis then, or my point then, would be to really, it's quite simple. I always feel a bit funny when I philosophize a lot and then my conclusion is, okay, we should care about each other more. But really my conclusion would be just being really more sensitive and more open to all of these possibilities that allow to face these ruptures and face these very difficult positions, because it's also the task of the community, the task of the person who is talking to the pregnant person to be challenged, I think, to face something that is hard to categorize, to maybe see a profile that doesn't fit what they expect, and really still be open to this and say, okay, how can I really help you? This, I think, is all I'm trying to do, because I'm afraid, like, we know so much, we really know a lot about a lot of things, but we hardly put this knowledge to good use. I think I always think if I cannot use the knowledge I have for caring and loving other people, this knowledge is really for nothing. And I really believe this, and I think all of these bubbles of knowledge, all of these textbook graphics, anatomies, this is what's happening to you. Okay, like, what contraception do you want after the abortion? Let's talk. And you're like, okay, I just really want to take a second and have someone talk to me about, have someone who knows more than me maybe, to put this knowledge into good use and help me understand better. And take the time for, I hope also healthcare professionals take more time to assess each case individually. Maybe if any healthcare professionals come across this video at some point in the future, I hope they take like one thing out of it. But also for people when they're talking day to day with their friends or family members who are going through situations like this, to be more accepting, to be more open and say, okay, like, I know this is very hard, but what would you really feel in this? Even if it's two very contradictory things that synthesize in one confusing thing, what is that thing? And how can we create a space where that really confusing thing can be actualized? So this, I think, would be how I want to conclude. I did want to read, apart from a poem, as my conclusion. And it's from Anne Sexton. The poem is called Unknown Girl in the Maternity Ward, and it's quite a long poem. But I will read one stanza of it. And the poem is about a woman who has just given birth, and it's in a I would understand as a mental institution because she's mentally unwell to raise a child, and they're about to take the child away, and it's the reflections of the woman during, like, right after childbirth. And it goes like this. Okay. She says, the doctors are enamel. They want to know the facts. They guess about the man who left me, some pendulum soul, going the way men go and leave you full of child. But our case history stays blank. All I did was let you grow, and now we're here for all the world to see. They thought I was strange, although I never spoke a word. I burst empty of you, letting you learn how the air is so. The doctors chart the riddle they ask of me, and I turn my head away. I don't know. This really, although it's a very different experience, when I read this, I was like, I cannot imagine how many women have felt like this, even if they could take their babies home. They just did not know what was going on in the institution bed they were laying in or the house bed they were laying in, and everyone's just coming up with their own questions, their own statements, and there's just this really inexplicable thing happening in one's soul and body, and you just do not know, and no one seems to really care about the actually facts that actually matter, but it's just the weird facts that are on the charts. So I think this poem would be a good way to end all of my thoughts. And I hope I offered like at least the slightest bit of food for thought. And we can all know without knowing more better, I hope.
Thank you, Defne. This was fantastic, and I wish you lots of good luck in your future career, because you bring beautifully together heart and knowledge, and this is exactly what we need.
Thank
If
you.
you want, please share with me the poem, and I will paste it
Yes.
in later on. I will paste it under the YouTube video. We have already one question from YouTube. Kayla asked you, do you think prenatal checkups should include the spiritual counselors or mental health professionals?
I think this of course depends from case to case. It also depends from what sort of medical practice we're talking from, because it's really different in the West than other cultures, I think. But I also find it gets a bit presumptuous when we try to forcefully include a spiritual aspect to medical procedures, because I remember I got a surgery when I was 13 on my back, and after I was in a lot of pain for a long time, and I didn't speak to anyone, and my parents were very alarmed, and they thought I went depressed and I wasn't coming back at the age of 13. So they did get like a psychiatrist from the hospital, but I also found that quite forced, because it was like, okay, this person is going through something hard, let me also give this treatment to you. So I think the answer to this is, of course, there should be, but I think it should be embedded in the ethos of the medical practice instead of it being a need or a procedure we should just include because what we have so far is lacking. How can we make this lack? It shouldn't be a policy fix, I would say, but it would be really ideal if it was the change in the ethos of the medical procedure, of course, and this ethos spreading into the community and the family, of course, because it's not just the doctor's office, it's outside the doctor's office. But definitely it would help more if doctors realize their patients are human beings and that their condition is not something that they see 100 times a day, I would say.
Yeah, that's why we have now we're developing medical humanities to manage to bring to connect both sides. But I'm thinking of the trainings that medical professionals have to go through.
They should all study philosophy.
And it's so hard, right?
So hard, yes, because it's completely two different fields also.
Yeah.
But in general, I think there is no body specific problem. I really think all health problems also we should really try to see from a more holistic perspective. We should really understand how it ties to the patient's soul or personality, of course. So I really think, yes, this should be expanded, psychiatric care along with bodily care coming together nicely should be expanded in all aspects of medicine, I think. But it's hard. I also think of it a lot. How do we train professions like this?
Right. Kayla, thank you. Says thank you. And we organized our education in body and mind, nature and spirit.
Yeah, body and mind. Yeah.
everywhere.
Yeah.
Cristina, do you have questions for Defne?
Well, I was thinking during your speech, thank you so much. It was very interesting about traditional midwives. No, we know from the history that when childbirth was followed by traditional midwife, it was more attention to emotional aspects and also more support, more female support towards pregnant people. And with the medical knowledge, we missed this kind of support. And maybe for this reason, nowadays we have more doulas and more women, more pregnant people that are looking for doulas. So I don't know if you thought about that.
Actually, yes, I think my parents are watching from YouTube. They would probably laugh here because a few months ago I was impulsively thinking, oh, maybe I should become a midwife, and mix my philosophy knowledge with like studying midwifery and mix this two and actually offer some good care for childbirth also. But this is a very also interesting addition to what I talked about, I think, regarding birth, regarding childbirth. I think the problems I addressed with medicine and institutional expectations is really even higher during childbirth, because a lot of women are put under conditions in the moment of labor also, which is so vulnerable. They have to undergo a lot of procedures that they didn't consent to or they didn't understand. They're giving epidurals even if they didn't want to, and they then have other complications because of this epidural they didn't want, but in the moment they were like, okay, she's feeling vulnerable, and the doctors are like, okay, it will be quicker if we give the epidural, and then this puts the baby in distress, and then there are emergency C-sections, like all of these. I researched these a lot as well, and I think it can be a very fruitful, like, new discipline if we mix what we know through science with this more holistic approach of doulas or midwives, so that also women can get proper birthing experiences. And we can also decrease birth trauma, because there's a lot of birth trauma because of this reason as well. But I am definitely also very interested in this. I considered it for some time. Yeah.
Thank you. Sometimes I also think about to
Yeah, it
become
would be very
a
interesting.
midwife. Yeah.
Yeah, I usually think it would be like a really good way to be in a space where I can actually help women. And it's not just on paper feminism, but actually working with women and actually doing something practical. It is a very fruitful area, I think. Yes.
Another thing that I found very interesting in your talk, and very philosophical, but real at the same time, was when you said, when you mentioned, the pregnancy stick as the thing that is supposed to reveal to you that you are pregnant. And this is the red line of your presentation, because later on you were talking about ultrasounds. I mean, I wonder if we're delegating to technology, the power of being alive, being a living body, right? Because yeah, you're right. I mean, it's so simple, but it's true. It's weird that we
It's
delegate.
weird, right? It's so simple, but it's just
You're so right that we delegate to this stick a miraculous power to tell
so
us
much
when
power. Yes.
you're pregnant. And while I was collecting the material for my book on phenomenology of pregnancy, I spoke to many women who told me that they felt pregnant even if maybe the pregnancy wasn't there, or even if the pregnancy, they felt that they became mother even stronger than that. Even if the pregnancy wasn't there, or the pregnancy wasn't, was interrupted, or didn't lead to a baby, and so on. So I don't know, there's not a question here. I'm just sharing the sense of taumazein of, it's true. We are delegating to technology something really powerful.
Yeah, I think we really lost track of a very powerful way of knowing things in this pursuit of clearly and positively knowing things. We really have lost a bodily intuition, I think. And not just with pregnancy. I think this really is the case for like all of our bodies in the modern world. We don't really have an in-touchness with what is going on, and we're always relying on a blood test or a checkup or something that a doctor can do or technology can do to verify or not verify the feeling of wellness, unwellness. This is really weird, especially the pregnancy stick. It's a funny signifier also in pop culture as well. It's so much power in like one stick or like one ultrasound image. But there's so like an infinite horizon beyond this, I think, when it comes to knowing one's body and knowing what's happening in one's body. That's more than just also being able to envision maybe through images we've seen, because we can all envision what's going on now. We can't really not see a pregnant drawing when we think of pregnancy. But I really was thinking, like, if we bracket all of this out, like, what do we really know of pregnancy? And it really isn't much. So it's either this I found, or of course, a very politically, ethically murky, like, debate which is about is the female body sacred, is pregnancy sacred? And this really also misses the point, because yes, it's on one hand demystified, but on the other it's not a moral mystification we should be after, but it's either one of these two. I think it's either very brute or very morally imposing, and there is no in between, and there is especially not a lot of in between for more challenging or vulnerable cases of pregnancy, I would say, like unexpected pregnancies amongst young people, or pregnancies as a result of sexual assault, or pregnancies that cause a lot of health problems potentially. These more unexpected cases, I think, are really reduced to meta-narratives that don't give us a way of knowing them in the first place. So we can't tend to them, of course, if we don't know them well, I think.
Thank you. Yeah, and here the work of Nicole Miglio on ultrasounds, also our dear colleagues who just had a baby, it is really good, because sometimes these ultrasounds doesn't give us the actual picture of what's going on, but it creates a narrative. Here we have two more questions, one from Nedim and another one from Kayla, who really appreciate the lenses you use for this analysis. So Nedim asks, in what ways does a pregnant woman reestablish intimacy with her own body during pregnancy? And then Kayla, it's a comment. As a Black woman, I think of the infant and maternal mortality, being so high for Black women, and the urge for holistic care and doulas, as well as an unconditional lens of love when being cared for. And she really appreciates the direction of the conversation.
Yeah, I appreciate the comments a lot as well. I think caregiving as an act of love is also what I was trying to convey with all the philosophical points, but it's, I think, in the end, not very philosophical at all. It's just a matter of the heart and caring. Okay, so for the other question, I think this is a very subject-specific question, of course. It depends on the person's situation a lot, like what this person understands of intimacy. I mean, if it's a married, pregnant person, of course, I think intimacy with the self also includes intimacy with the husband, or intimacy with the partner. But I would say the problem, I think, is not that it is hard for a person to reestablish intimacy with oneself or to make peace with a new body, but it's really a lack on the outside from all of these systems we're supposed to draw our care from that don't really give us anything to think these things through. Because these problems, yes, they end up to be personal problems in the end, but they are rarely, I think, caused by a personal lack of being able to understand something in oneself, but it's a lack of being able to express it and a lack of being actually understood in this. Because I can say, not just for pregnancy, but in any moment where I felt very alienated from myself, a simple conversation with someone who made me feel a bit understood helped me so much, like this much more than what I could have done myself through meditation or all of these good practices. Like a good how are you, like a genuine how are you, I think helps so much for someone to reestablish intimacy or peace with someone. So I think the solution to this is really each person asking themselves, okay, how can I really provide care for the people around me, whatever it is they're going through? And this would take the situation from 0 to 50 easily, and I would say.
Thanks. Yeah, and this brings us back to what you said at the beginning, which was also very beautiful, that, you know, an experience as unfortunately as common as an interruption of pregnancy or a pregnancy loss leaves us with no words. We don't know where to go with the thoughts. And I had the same experience for a miscarriage. Yeah, I didn't know what to think.
Yeah, I was just blank.
Yeah, and I'm a philosopher. I mean, I should. So yeah, I really think that yeah, if we are genuine with our care in all our jobs, which could be philosophy, medicine, I don't know, teaching, engineering, whatever, architecture, really, if all of us were genuine with the thinking of how can we care for each other, how can we care for another in this experience, we can provide more categories to
more proper
take care of
categories.
each other. Yeah.
Yeah, and better categories, because I also think the categories through which we talk about pregnancy, they're really insufficient. Like I said, they either hit against a wall of weird politics, ethics debates that are also really polarized. I think they never get to the bottom of the issue, because the issue with like abortion, for example, it's not pro-life, pro-choice. What is this binary, like life versus this is not even a real category for me, for example. Like there are no real proper categories through which pregnancy is thought through. I think it's always about what it means to the outside world. It's always what it means for the family, the society, what it means medically or morally. It's never really about what it means to be pregnant and to reproduce or have reproductive capabilities, I think. And I also don't have a lot of ideas for categories, but I think through really being genuine with the care we give, we can create these, I think.
I agree. We have one more question from Asli. Does pregnancy transform a woman's sense of self, or does it reveal something that was always there? What do you think? Is this our, this is a tough one.
It's a tough one.
Is this our most natural state or just the hormones talking? Here we have many questions in one.
Yes, okay, okay. For the hormones, I will give a more general answer about with my thoughts on physicalism in general. And if any of the people on YouTube are not philosophers, we say physicalism to generally refer to as explaining phenomena or the substances we encounter through their just physical properties. So for example, we have this a lot in modern psychiatry. If someone is depressed, we say, okay, they don't have serotonin. If someone feels a certain thing, we say, okay, this is because this physical thing, an atom, a cell, a hormone, a molecule, a physical thing, just creating other physical things. But I really think, yes, of course, it's hormones. There is hormones. But there is hormones always. I think even our normal state when we just wake up and look at there is hormones there. There is hormones when we're afraid. There is hormones when any real experience, there is hormones. In any real experience, there is a physical explanation to it if you really look for it. But this doesn't account for lived experience. Like I said, it's not really, you don't really think, okay, I have this hormone a lot, so the stick said 2 sticks, yes, thus we don't assess situations like this, or we don't say, okay, I look at this person and I have a rush of dopamine and serotonin, I'm in love with this person. We don't say this. So yes, of course, it's about hormones, but there is also another reality behind the hormones, I think, and it's a richer, more hard to understand reality, but it's still more real also, in a sense, I would say, to the hormone question. And the other question, yeah, it's a hard one. It's very poetic of a question, I would say also, yes. I think it definitely changes the sense of self of the pregnant subject also, giving birth, being pregnant, it changes radically, also because of the hormones. And I think understanding the hormones is a good tool to understand in which areas we need care. Because, for example, when we look at postpartum hormone fluctuations, the moment birth is given, estrogen radically drops so much. Of course, we have postpartum blues, we have postpartum depression, but I think understanding these changes helps us see, okay, yes, pregnancy severely changes someone's body and someone's mind. So how can we understand this better? This is one aspect. So yes, it changes someone. And about the revelation in revealing something about the mother part, I would say yes, of course. I mean, any difficult experience reveals something in us, but I would say the revealing something in us part is more a part of parenting, because then we are actually faced with another that is out of our control. And the parent-child relationship is a very, very particular one. I was never on the parent edge, of course, but as a child, with also like an interesting relationship with my parents, I can say it really, I think, makes the parent confront themselves in a way that is really hard, because you have to really care for and love a small human being that doesn't know what they're doing in the world, and they always make mistakes and they always do wrong things, and you're always, okay, I birthed this child, or if it's the father, it's my child, with, you know, we made this child, and this child is now acting completely out of our control, and we are resentful, we're bitter. How do we love and how do we care for this child? This, I think, is a very complicated, particular relationship that reveals a lot about the parent, because you face yourself a lot. Why am I mad at my child? Why can't I give love to this child? This part, I think, is more self-revealing. But of course, there's self-revelation, I think, in all experiences, like I said.
I totally agree. Yeah, thanks for this beautiful answer. I think there's unfortunately, especially toward women, minorities of any kind, you know, health minorities, racial minorities, a kind of a dismissive attitude circulating in our society, for which if you are not inside certain boxes or norms, you should not cultivate curiosity toward yourself. And so, yeah, okay, you're perimenopausal or menopausal, and here it's the hormones talking, just take these pills and get better. Or you have this psychiatric disorder, yeah, you're not in your right mind. I don't know, I think we should cultivate a healthy curiosity for any present lived experience we are going through. It's the hormones. Okay, it's
interesting either to say, or it's not philosophically interesting either, I think.
Exactly, yeah, it's my present, it's maternity. Okay, I want now, this is the most the truest part of me, and I'm curious about what's going on here. I think we should reignite curiosity and passion and care for yeah, for the present lived experience. And I do appreciate the fact that you had the courage to share yours, because yeah, it's unfortunately how our investigations start, our real sparkle for knowledge.
The curiosity of like actually being brave, I think, with the thoughts we entertain, even if we think, okay, this is an absurd proposition, but it's always good to start from it with a blank curiosity, I think, to see where it can go, because otherwise, yes, like you said, it's easily dismissed. It's easily, okay, we know what this is anyways. You fall under this category, so you know what this is as well, but this is not how we understand truth, I think, or this is not how we know things either. We don't know more because we can name it, definitely.
Thank you. Thank you. It was a beautiful webinar,
yes,
a beautiful conversation.
Really
I don't know if Christina has anything to add or ask here on YouTube. We don't have more questions.
No, but thank you so much. And thank you also for your courage to share with us your experience.
Thanks.
Thank you for your speech.
I wish you, I mean, you had lots of courage to present, and even without PowerPoints, go.
PowerPoints would make me less courageous. They really confuse
See,
me.
that's how you work better. And I mean, very, very grateful for this beautiful talk together this morning.
I'm very grateful that everyone listened, also on YouTube. Thanks a lot.
So enjoy your day, and who knows, maybe I'll read of you soon elsewhere.
Yes, I hope so as well. I hope to hear from you soon.
Okay.